So my name is Nicole Ammon. I am a licensed professional clinical counselor, and at Neomed, I work in the Department of Psychiatry in the best practices for schizophrenia treatment. I'm specifically focused on integrating primary and mental health care. And I did this talk a while back for our integrated care ECHO, which is comprised of a variety of professionals, largely from the mental health fields, substance use disorder treatment, primary care, peer support, public health. It's a pretty interprofessional group, much like this one. But in preparation for today, I expanded my literature review to include first responders, law enforcement, fire, EMS, and other professionals that are more represented in this ECHO than maybe I typically would see in the integrated care space. Before we get to the heart of the short presentation, one of the reasons that I believe it's important to talk about amplifying joy in our work is because usually the conversation is more centered around burnout, and it's valid. Burnout is a terrible problem. Burnout is included in the 11th revision of the International Classification of Diseases, not as a medical condition, but as an occupational phenomenon. It's defined as a syndrome that results from chronic workplace stress and is characterized by three dimensions. So feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativity and cynicism related to one's job, and reduced professional efficacy. And I don't want you to think about burnout as the opposite of joy or vice versa, but given the prevalence of burnout across our fields, I start here because burnout can result from an absence of joy. So when we think about absence of joy, our professions all have slightly different cultures. However, when we think about the cultures of medicine, mental health, first responders, law enforcement, they're all pretty similar in that they're often saturated with both explicit and implicit messages about self-sufficiency, competitiveness, and about not showing any kind of weakness or vulnerability. These messages often lead us to behave in ways that promote burnout. So things like perfectionism, self-criticism, denying our vulnerability, delaying gratification, all of which results in suffering in silence and potentially working in isolation. And our work often exposes us to conflict, trauma, despair, death, sometimes even violence, all of which can contribute towards burnout and sometimes even more serious results, things like suicidality. A 2023 study noted that law enforcement professionals are 54% more likely to die from suicide than the general population. And the Medscape Physician Suicide Report from 2022 found that 1 in 10 physicians had considered or attempted suicide in 2021. With emergency medicine, family medicine, and psychiatry, those people that maybe in the medicine space we interact with the most, we're at the top of the list of the specialties with the highest rates of suicidal thoughts. And this is really common across mental health and substance use disorder professionals as well. But for today, we're going to think about the flip side of that coin, joy. So think to yourself and feel free to share in the chat, and we can talk about it a little bit after if you'd like to, and there's time. But how do you define joy? What does it mean for you to have a sense of joy in your work? And how often do you get to experience joy through your work? So joy is defined as the emotion evoked by well-being, success, good fortune, or the prospect of possessing something that one desires, a sense of delight, or the expression or exhibition of such emotion. It can also be defined as a state of happiness, a state of bliss, or a source or cause of delight. Joy and happiness are very similar, but they're a little bit different. Happiness, I think of more as a personal emotion, a quality or state of being happy, of that outward expression of elation, ranging from a sense of pleasure to contentment. And it's a wonderful feeling, but overall fleeting, like most emotions are. It passes the way that all emotions do. Where joy can really be thought about more of as an attitude, something that we can cultivate, and sense of inner peace and contentment. It's longer lasting and not as transient. Joy can be thought of as contagious and transcendent. It rubs off on other people in a reciprocal way that it's also reinforcing. So studies actually show that optimism is correlated with lower rates of cardiac-related diseases, that hopefulness and curiosity seem to be protective against hypertension, diabetes, and even upper respiratory infections. And that could be because when we feel joy, our brain releases dopamine and serotonin, so these feel-good neurotransmitters. And at the same time, it's producing lower levels of cortisol. Cortisol is our fight or flight hormone. It's produced when we experience stress, super important in the moment. But when the danger passes, our cortisol levels should kind of calm down. But too much stress can result in prolonged periods of elevated cortisol, which is really bad for our body. It can increase inflammation and it can dampen our immune functions. But joy, optimism, hopefulness might be an antidote to this. When I've done reading outside of the formal academic type literature space about joy, there's some discussion around the 8 pillars of joy, which when you take time to consider each one of them, they're going to make sense at an instinctual level, at least to me. Each of the pillars is a potential way to cultivate joy. So perspective, so the attitudes, values, beliefs, having an understanding that we're interconnected. Humor, lots of studies on humor are showing that laughter boosts your immune system, it relaxes your body, it protects your heart by lowering cortisol. In general, it feels good to laugh. Laughter can be a respite from pain. And humor that doesn't mock or belittle brings us closer together. It helps us to process both the cognitive and emotional aspects of situations simultaneously in a way that other things maybe don't. Humility. Obviously, having a positive self-image and a sense of competence is really good and important, but humility to accept that we can't know everything about everyone else, anything or everything about anyone other than ourselves, and a sense of valuing learning both with and from others. Acceptance, without resignation or giving up, but accepting that we can't change some things. We can just try to improve what we can daily. Forgiveness. Forgiveness allows us to release attachment to the past. It doesn't mean that what happened is acceptable or that you forget about it, but allows anger and sadness to be temporary emotions and allows us to live in the now. Gratitude. The author David Steindl-Rast, who's also a monk, has been quoted as saying, "The root of joy is gratefulness. It is not joy that makes us grateful, it is gratitude that makes us joyful." Brene Brown, the psychologist who's done a lot of speaking, and I'm sure people have seen little videos, at least on YouTube, she states that practicing gratitude invites joy into our lives. And there's even some research that shows that keeping a gratitude journal can correlate with self-reported increases in happiness and more engagement in health promotion behaviors. Compassion. So compassion is a sense of concern that arises when we see others suffering and we wish for that suffering to be relieved. It's a bridge between empathy and kindness. And generosity. The more time that you think spending about yourself, the more suffering you experience. But the opposite is also true. The more time you spend on the well-being of others, the more joy you experience. Giving to others does not subtract from ourselves, it adds. So how might we translate this to work? Joy in work is an aspirational state where professionals are emotionally and behaviorally compassionately engaged in their work and the mission of their organizations. That joy can be grounded in the relationships that we form with those we serve and interact with in the community, also in the clinical settings, with colleagues, with family, with friends. Opportunities for reflection in group settings, such as Project Echo, can strengthen our sense of purpose and meaning in our work, while also enhancing our sense of community and shared values, which are 2 drivers of resilience. Such groups also create space to reinforce one another and the importance of caring for ourselves and for one another. So we can continue to do that. And joy is possible when we live in the present. So going back to those pillars, when we approach our work with gratitude and acknowledge that we have a privilege of serving others, we can cultivate more joy. When you look at the research around all of this, there are factors associated with experiencing joy at work. In a study done back in 2003, the primary source of joy was identified as the people and the relationships. So the patients, clients, community members, or colleagues. One person described it as a feeling of well-being surrounded by people you love or care about. It makes having one-on-one contact and opportunities for socialization super important. And I would add to that the opportunity for in-person connections. As much as Zoom helps, like we see today, we need to see people in the real world too. The second area was the work itself, feeling a sense of passion for the work and that aligns with your personal mission, feeling excited about the work you do, feeling an internal sense of achievement or accomplishment, liking like that you're doing good, that you're overcoming a challenge, that you're making a difference. Sometimes that can mean getting accolades or input from others, but it also really is about that internal feeling. And when we think about getting recognition, it could be as simple as an expression of gratitude. So it's good for the person expressing it, and it might positively impact the person receiving it. The work environment also contributes, so organizational culture, social interpersonal aspects, and this is an area where the individual often has or feel like they have very little influence. But this, as with all of the areas, it's very much worth talking about in more depth at another point. But for now, we're just going to look at this from a conceptual stance. And then individual factors that can be brought into play. So certain characteristics are more or less associated with experiencing joy in our work. ranging from individual beliefs, attitudes, values, sense of self-esteem, competence. All of those impact our perceptions of joy. And the picture on the right is a model for understanding one of the researchers in this space, Mannion, his thinking around it, where external factors provide a stimulus for joy to occur, and then the individual factors have to make space for it. I recall that joy is contagious, so expressions of joy, smiling, laughing, those things tend to make the people around you feel better, which in turn reinforces your perception of joy as well as theirs. So some barriers to joy in work, loss of one-to-one real-time in-person interactions, which speaks both to Zoom, remote work, and that inherent tension between business and service in the fields that we're in. As I noted in the beginning, our cultures of our various professions are saturated with both those explicit and implicit messages. Things like self-sufficiency, competitiveness, perfectionism, working too much, maybe too much overtime, working well beyond your hours, even if you're not getting too paid overtime, just working well into the evenings, not having a good sense of work-life balance, unwillingness to show weakness or vulnerability, which really speaks to stigma around mental health and seeking treatment for mental health issues like depression, anxiety, or PTSD, and compassion fatigue. So compassion fatigue and vicarious trauma are talked about a bit in the health professions and in mental health, but they absolutely occur among law enforcement and frontline providers as well. And there is some stigma around these that we have to find ways around to get people more comfortable talking about them. Things like unfavorable work conditions can be barriers to joy. So staffing issues, negative coworkers, inadequate resources or inappropriate use of resources, a lack of autonomy, authoritarian leadership styles or poor supervision, monotony, odd hours, failure to set boundaries between work and other things. And all of these can be barriers to feeling or cultivating joy within our work, but each of them can be tackled both individually and organizationally. And it's important that the research in this space notes that an individual's attitude is both necessary and sufficient for that individual to experience joy at work, but joy can transcend a particular situation or workplace. But that attitude's not enough to maintain create a sustained joy in the work over time. So you can experience it, but for it to be sustainable, we have to have both the internal factors and external factors. So this figure is intended to show some of the dynamics at play between the internal and external, each factor potentially contributing towards or impeding joy in work situations, with no single factor which is going to be the result of resulting in joy or a lack thereof. It's more of this cumulative effect. So each one of these areas requires our attention to achieve a sustained joy or sustained capacity for joy within our work. So how do we improve our capacity to cultivate joy in work? Lean in on your connections to your community, however you define community. A primary source of joy is relationships, those meaningful connections, a sense of camaraderie and teamwork. Our social interactions are just as important as our task-based interactions when it comes to developing psychological safety amongst well-functioning teams. So invest time in getting to know your colleagues, loving your work, having pride in it. Our professions have the ability to produce a sense of purpose when we believe that we're engaged in meaningful work and that we're fulfilling a personal mission or personal passion. The organizational work environment, obviously, it needs to develop competent management and collaborative leaders. It should foster teamwork, supporting regular communication, providing opportunities to learn and grow. People do best when they're given some autonomy and authority over at least aspects of their work. I've heard something called a 20% rule, where maybe 20% of your job should be on a task or activity that you really love. It gives you space to maybe make some choices when it's possible, whether it's over hours or shifts or particular focus areas. Recognition, making sure that workplaces and organizations are expressing appreciation and gratitude to their employees. Designing organizational systems to address human needs and allow people to ask for what they need. Removing sources of frustration and inefficiency. So things that organizations can do is ask the staff, like, what matters to you? What are the things that impede your ability to engage and cultivate joy within your work? So what's the pebble in your shoe? And commit to a systems approach and making joy in work a shared responsibility at all levels. Also supporting personal wellness and an organizational culture that really does invest in personal and individual wellness, which is really important for us to be able to bring all of our magnificence and messiness as humans to the work that we do. So just a couple closing thoughts, and we can have as much discussion around this as Hannah wants to engage in, because she is our facilitator, and I just appreciate all of you taking the time to let me give me a couple minutes to speak today. But how do you contribute towards joy in your work, and how does your organization help or hinder this, and what can you do? With that, I'll stop my share. Oh, here's some resources too. Thanks.